Health is wealth, so they say, but people have lost wealth in the search of health. And it is in this context that the National Health Insurance Fund was born to help people at least to soften the blow when it comes to losing their wealth in search of health. And to talk about the benefits of NHIF and all the things that entail and how you can register and everything that is under the National Health Insurance Fund is our representative from NHIF, Madam Mary Nyachai. And we've gotten that out of the way, that her name is Madam Mary Nyachai. Thank you very much for being coming on set to talk about matters NHIF and health in general in the country. We've already known that your name is Mary Nyachai. That is out of the way. So what do you do for NHIF, just as an icebreaker?
Okay, thank you very much. It's my pleasure to be here in Ebro TV. I work as a regional manager in Nairobi, covering the Nairobi County, Machakos, and Kajiado counties. Right. Yes, so all the hospitals under there, all the companies and all of that, they fall under my region. Yes. Very nice.
A very good description of who you are and what you do for NHIF. First, let's get this out of the way. What is the value proposition for one to be enrolled under the NHIF cover? What are the benefits that if I get to enroll myself in this, I get to enjoy?
Thank you. That's a very good question. First of all, NHIF is for all members, you know. First of all, NHIF, it used to be National Hospital Insurance Fund. We changed to National Health Insurance Fund because now we want to cover the kind of packages, the kind of benefits now are wider, even reaching a person to the community level. For a person to be enrolled with NHIF, all that they need is the ID card, just ID card. And once you come with the ID card to any of our offices, which are, we have offices like in around over 170 countrywide. We have Huduma centers, we have satellite offices where somebody can come and register. So as you come with your ID, you will present it. Once you present the same, you are registered, and now you can actually begin paying and then get the benefit from NHIF.
Right. You've talked about covering everyone. It's a free-for-all affair. So currently, what are the numbers like? How many people are there under the NHIF cover at the moment as we speak?
Okay, before even I say about the members, first of all, for a member, the member we said it's 500 shillings per month for self-employed. And then we have another group of people, which is the former, the ones who are employed who get deducted from that. So currently, we've been aiming to actually register every member, but currently we are about 8 million, we can say, who are members registered. But the problem is that they don't, some members pay and they default because of the hard economic times. So all these members actually can benefit from many of our hospitals countrywide. So the ones we have, we say, even if it's say 8 million times 3, like a family unit can be over 5. So we have over 20 million people enrolled in NHIF. Yes.
It's a good thing you've mentioned about that. So what are the repercussions when someone defaults in paying their contributions?
Yes. Even as you ask this question, I also remember, for a member, once the member registers with NHIF, it takes 60 days for the card to start being valid, first of all, for start getting benefits from our hospitals. Once you do this, then a member is encouraged to choose a hospital of their choice where they can receive the outpatient cover. And if this member at a point defaulting meaning they fail to pay their monthly contributions, this will make the member to miss getting the services in the hospital. So all that they need to do, there is a penalty which is around 250 shillings per month of defaulting. So the member will come and pay, or they'll pay using an M-Pesa, which I'm also going to give you. Once they pay that, then they can continue getting their benefits. If it's an employer who defaulted paying, we also give them a penalty, and they pay the same to NHIF so that their members can continue getting these benefits. Yes.
In a way of trying to reach even a bigger population, to increase the 8 million number to be even wider. Nowadays, everything has gone digital due to the embrace of technology. So how have you taken advantage of technology to help people at least to be able even to self-register for the NHIF, because you've seen there are some other avenues or places or things that people can do a registration to get on board onto a service through the use of something as easy as a USSD.
Yes.
as USSD number, as NHIF employed the same?
Yeah, very good question. Yes, NHIF has employed that. We are also actually heading with technology, even in our claims processes, in our registration processes. We are really going digital in much of all these processes. So for registration, yes, a member can register using our NHIF app. They can register using a USSD code, which is just *155#, and then they're able to follow the instruction and be able to register themselves. The same, they can also be able to choose the hospital of their choice where they would want to be treated. Immediately they register with that, they get a prompt telling them, you're welcome to NHIF, you've chosen this service provider, and this is the hospital that you can actually be going to once they choose that. Yeah, so we've employed that. Yes, and we are in all the web, let's say in the social media. So a person can be able to ask questions in our Facebook media, in Twitter, and in all of them. Yes.
Now, are there limitations in terms of the technological advancements that you guys say, that you say you have employed? For example, you've mentioned the app and also the USSD code. So can I manipulate everything that is there, or there are things that are specifically left for the NHIF office or service provider that is put in place to ensure that these things happen? One of them is like adding dependents or removing a dependent or changing a facility.
Yes, yes, that's right. Like for NHIF app, for anybody to be able to use that, it's more of a, you're able to get your information from that app, but you are not able to add dependents on yourself. The only time you can add a dependent like a spouse is the day you're registering. You put the ID for the spouse and the contributor. But for any other addition, it's done at our offices. Yes, so somebody has to come to our offices, this one, to verify first. You know, there's some information we must verify before actually it's put in the system. So that's what happens in most of this.
Right.
Yes.
Now, there is also another very important questions that I did get from somewhere, from someone, about biometric registration. Do you also have this?
Yes, we actually. Now, before, you remember, everybody, I don't know whether you have one card, I think you're young, we used to have NHIF cards, whereby once you register, a card is printed out for you that you present to the hospital. We are no longer printing cards. We've gone to biometric registration, where a member can be registered, be it at our service points, within the ones which I've said, within the NHIF service points that we have countrywide. They can also register in the hospital where they've gone to. We have given that platform also to the hospital for the member to be able to be registered from that place. Yeah, so biometrically, we are doing it every day in our branch offices, Huduma centers, and other units. We even go out there now to register people, be it in the marketplaces, in churches, wherever we are invited or wherever we see a need. So that registration is something we keep doing throughout. Yeah, so members just can only, once you reach the hospital, you present your ID card, and then once you're registered biometrically, you get the services.
All right. Now, we do understand that NHIF is a product for Kenyan people. So someone would ask, if in the event I have traveled outside the country, then I get sick, are there partnerships of NHIF and hospitals outside the country that we don't know of, where someone can go get medical services and then pay using the NHIF, and then it is deducted from their Kenyan side?
Okay. We don't have exactly the same arrangement as you've asked. Yes, but we have one of our packages is called overseas treatment. Overseas treatment, for anybody to actually benefit, it has to be that the person must be able to first of all get an authority from our Ministry of Health, and then the Kenya Medical Dentist Practitioners Council, and NHIF, for them to be able to be treated outside the country. What you said is about traveling. If they traveled and it's within 6 weeks and they had the permit and all that, that's the one when they come back to us, we are able to compensate. What I can say, we've not accredited facilities out there, outside like in India, but we have those ones whom we have agreements with, service level agreements with, that when our members go, they go there and we pay them directly. Yeah, so we have a few for that. And this is for any member. In case in the country they are not able to receive that treatment, that one, once approved with what I've said, they'll be able to benefit from there. Also the civil servant. So yes, the overseas treatment is available for every Kenyan. Yes.
And a rejoinder to that, there are people who are from other nationalities who live in the country.
Yes.
can you, a contributor to the NHIF, have them included if you're the one hosting, or is there a provision that they can also register for NHIF at the time that they're in the country?
Yes, I think you're talking about the refugees. Yeah, most refugees, we've registered the refugees, but under the umbrella body of UNS and NHCR. And all these members, once they come together, of course, they have a way of identifying themselves. So all of them, we are able to cater for them also, and they are Kenyan citizens, they're also able to get those services from our empaneled hospitals. Yes.
Now, speaking about dependents and contributors, for example, I have a family. I have, say, 2 children, and I'm the main contributor. Do my children also enjoy the same benefits of being under the NHIF cover as I would, who is the contributor?
Yes, that's a very good question. A contributor, we assume now this is the person who's taking care of their whole family. We call household. Now you as a contributor, just with your 500, for example, if we can use the one for informal sector, it covers you, one spouse, and children as many as there can be, even beyond, even 10. Yes, so you'll be covered using this same card. They'll be able to get the same services that you get, depending on the hospital that they've been chosen for. Meaning the contributor will make sure that they are choosing a hospital of their own choice. You put the spouse, in case they live different parts of the country, let's say here in Kenya, they can choose where it's nearer to them, where they can be able to access the outpatient services. For inpatient, they can go to any comprehensive countrywide without choosing the facility. Yes.
Now, let me just bring you back to something that you said concerning the penalty that is charged for an independent contributor and someone whose employer contributes for them. What is the difference? Just try to give us the contrast, because I do understand if you're an independent contributor, you pay 500 shillings.
Yes.
But those rates may not be the same for someone who is employed. Give us a contrast of this so that we can be able to understand.
Okay. Our contributions for those people who are employed, that's in the formal sector, they actually range from as low as, let's say, like as low as 100 shillings up to 1,700 shillings, depending on what amount they receive in salary. That is different from the person who is in the informal sector, where we have a flat rate of 500 shillings. Yeah, so that's the difference, first of all. So for this, for the contributor who pays 500, the penalty, if they default, is 250 shillings per month defaulted. For the employer, is the total amount, like if it was 1,700, they'll pay a penalty for that. That one is also calculated with the different rates. So the employer pays together. If he didn't pay for 20 of them, the penalty will be for all the 20 and up to the time he stopped paying. Yeah, but another thing for penalty, if you fail to pay to NHIF card for more than 12 months, that's within a year, you will start afresh now again. When you come back, you're not going to pay penalty if a year has lapsed. Yeah, but if it's less than a year and you want to use that card in the hospital, the penalty has to be paid. Yes, at least to cater for those services. Yes.
Now, speaking of penalties, let's try see if there are rewards to this. If someone has not been sick throughout the year and he has been diligently paying his contribution for that year, does the NHIF contribution carry forward to the next year, or how is this?
Just like insurance, just using the insurance model. Much of the time, no. The money doesn't get carried. You know, we thank God when somebody has not used their card, so somebody else is able to benefit. Remember, NHIF is more of social health insurance, meaning the healthy is taking care of the sick, isn't it? So on that case, yes, it's if you don't use the card, somebody else will benefit from it. Remember, this is a pool. This is a pool where all the monies of the healthy and unhealthy is put, and it's used to take care of those ones who are unhealthy in the hospitals. Yes, so that's what it is. Though I know definitely maybe way going forward, I've had the plans maybe to make sure that maybe there will be some tax on it, you know, tax relief. But we are waiting for that. Until that is done, that's where we are at.
Okay.
Yes.
So in terms of the limitations to what NHIF can cover, you see, there was a time I saw a skit whereby someone went to have themselves circumcised and they're using NHIF. Are there limits to this?
It's an exclusion. Somebody's taking themselves to be circumcised, that's an exclusion. Actually, in our contract, we have those packages that we do cover, but circumcision is not among them. Yeah, unless for children who have maybe due to a medical condition, that's when surgery is done, yes. But for circumcision, no, we don't pay for that. Yes.
Kindly try to break down some of the things that you guys cover. For example, dental or maybe optician services. Talk about that in a little bit.
Okay. Yes, NHIF covers for medical conditions arising from dental issues and optical issues for the national scheme. There's something we didn't talk about. We have two different schemes. The one with the national scheme where every Kenyan is entitled to. They choose a hospital of their choice where they can be treated. If they have dental or optical medical issues, that will be attended in the outpatient package or in the inpatient package. But when now it comes to issues like spectacles, something needing optical, NHIF is not able to cater for that in the national scheme, but we cater for that in our enhanced schemes. Enhanced schemes are those ones where we are covering like the ministry, where NHIF has gone out and become the insurer of choice for these companies, the ministries, the counties, and all that. For that, we are able to pay because we have their extra medical cover. So we are able to pay for those, for optical and for dental. The dentures and all that's associated with that.
So this means, and in the event, I just like this clarification. In the event you've sought treatment for this, now, for example, eye checkups, then they find you have a problem. So does this mean if you do cover for the extra cost that you've talked about, you only pay for the medical services? Now, when I want to get the spectacles, are these also included in the cover?
Only for the managed scheme, only for the enhanced schemes. So spectacles, somebody will go out of their way to pay for themselves. Yeah, so we don't cater for that in the national scheme. Yes.
And of late, we've been hearing about the super cover.
Yes.
Talk about this and in detail.
Okay, thank you. The super cover actually is what we also refer to as the national scheme. The super cover is what is out here to be gotten by every Kenyan citizen, whereby you choose a hospital of your choice and you go walk in and walk out. Why we are saying walk in and walk out, we have different contracted facilities that we have. So for comprehensive facilities, a member will just appear, present their ID card, and be able to get all the services that are within that package. That's the super cover that we're telling every Kenyan. Once you register, you have a facility of choice, be it a government facility, a faith-based or private, where you go and you are attended to. That's the super cover, which has, starting from outpatient services, we have inpatient services, then we have even mental health, we have dialysis, we have surgical services, and many other services that are within that. So super cover, we call it super because it's a super cover because a Kenyan citizen will be taken care of wholesomely, them and their family members. Yes.
Now, someone may relocate. Perhaps maybe they're working in Nairobi, then their job gives them a transfer to another county, or maybe they're told to go back home.
Yes.
So how easy is it for someone to change outpatient facilities or inpatient facilities from where you used to be to the person to the place that you are currently residing, including the dependents?
Yes. Yes, thank you. That's also another good question. We have given, there is a leeway of you choosing, even beside moving. If you're going to a facility and maybe you don't like the services that are offered there, we have a limit of 3 months. Within 3 months, you can go back to the *155# and you choose another hospital. So if somebody relocates, that still applies. If it's within, we call those 3 months because that's the time when we pay their monies to the facilities where they can go and get the services. In case it was in between, when the member moves, they go to our nearest offices and then they say, we were capitated somewhere else, we've located here, we would like to get services in this place. And there is an arrangement to have them attended to the facility where they've gone to. Yes, so, and this happens with even the dependents. Remember, family units sometimes are not all together. So if the dependents, for example, are in Kisii, where I come from, they will be put in a hostel in Kisii. If the spouse is in Nairobi, he'll have theirs there. And this one also goes the same. If within 3 months you don't like, you'll be able to change and be able to get services.
All right.
Yes.
Now, also give another clarification concerning this. Now, I am the contributor. I work in Mombasa. My family resides in Nairobi.
Yes.
So, is there a possibility of me having two hospitals where if I am sick, I'll be able to be treated where I work and my family will be treated wherever they reside?
Yes. This can be if your spouse also has an NHIF card. Yes, if your spouse has an NHIF card, when she's choosing hospital, she'll choose for you the facilities which are in Mombasa. And that's when we encourage, like, if possible, the both of you should be able to pay to get these services like that. In Nairobi, you can choose for them now for here. So it's possible to have two facilities where you can attend. Yes.
But still, I do want further clarification on this.
Yes.
Both of you have NHIF cards.
Yes.
So it means that you'll have your number and I'll have my
Yes.
NHIF
Yes.
number.
Yes.
So do you have a system whereby these two numbers are intertwined and someone can understand that they are of the same family, or how does just help us understand the mechanics of this?
Okay. An NHIF number, just like an ID card number, is a unique identifier. Now, this number that you have for NHIF, it's yours. It's your personal number. Your spouse will have their own number. Yeah, though in a family unit, you know, one card can be enough. But in cases both of you are working, definitely you both have those numbers. There is no time that we will intertwine your number and your wife's, so that maybe even a benefit can accrue, so that maybe it was a bill, if you've gone to a private hospital, which is not comprehensive, that it pays half and half. So that's what I wanted to clarify. But for outpatient, yes, they have their number. You can choose your family to be there and another one here. There, if that's clear.
Now let's localize it to dependents.
Dependents, yes.
There is a mom, there is a dad, both with NHIF. Can all of them put the same children under their covers?
Yes. You put the same children. You put your children, the ones, yes, you definitely will do that. Like if she's in Mombasa, she'll put, if you have 4 children, she'll put you as the spouse. Now she's the contributor and the children will be there. You'll be now the contributor when you're in Nairobi, and she's now the spouse, and all the children will be there. Yeah, you're entitled. That's your entitlement in NHIF. Yes.
As in, has this brought any confusions before? For example, when my child would want to be treated using my card, and the mother's also offered to pay using her card.
Okay, the only confusion can be now to the member. Only confusion can be when the member thinks that these two cards can come together and pay a bill. Yes? But no, there is no confusion. If it's your card, at admission, remember, for whenever a member goes to a hospital as a patient, we get notified within 24 hours. Now that notification will have shown the contributor's number. Yeah? Now once that contributor's number has been identified, there won't be any confusion, because the number that was actually captured was your number, not the spouse's number. Yes. But if you use the spouse's number, remember there's biometric registration. Definitely it's you will have been there to have your fingerprints taken. Yeah, not for your spouse. Yes.
Well understood. Now, still on dependence, we know the legal age for one to be declared an adult is 18 years old.
Yeah.
So your children, of course, they're growing. Up to what end can you as a parent be able to have them under your cover? At what age? Is it terminated immediately they turn 18, or there is a provision for you to have them in the cover until, I don't know?
Yes, we are allowed, according to the Act 9 of 1998, the dependents, the children are those ones who are between 0 and 21. So, yes, you may have attained 18, but definitely maybe you're going to school. So, for us, the catch is we need to know that you're actually going to maybe be it a college or something. You have to identify and tell us where this child is going. So, for the national scheme, we cover up to 21 years. For the enhanced schemes, they've negotiated and we can cover those children up to 25 years.
25 years?
Yes, if they are in a college, in a university, something which they can confirm and prove to us. Yeah, but above 18, if at all not in any institution, we expect that they start having their own card. But if they're in school and they're still your dependents, you still will be able to cover them under that same cover. Yes.
So what are some of the milestones that NHIF has been able to make since, say, maybe its inception until this day and age?
Wow, that's a very good question. Yeah, NHIF, remember, it started in 1966, quite some long time. And it started just for covering only the formal sector, meaning the people who were employed. More, they are the ones who were benefiting more from this. But that was from 1966. Later, in around 2012, we also introduced the outpatient cover. So one of the milestones is that outpatient cover was introduced, and now members can benefit